Hello, I'm Dugg Steary, Paramedic Practice Leader for the Interior Region, and welcome to the June Clinical Governance and Professional Practice Update and our first update podcast episode. To begin with, I'd like to acknowledge that the land for which I'm recording this on is the unceded territory of the Coast Salish people and includes the territories of the Musqueam, the Squamish, and the Tsleil-Waututh Nations. Let's start with the heat and cooling center resources. So summer is almost here, and the prediction is it's going to be hotter and longer than last year. And a reminder that the heat A-star pathway is still active and should be used for these patients. The emergency medical call takers have a specific heat card, which is used to identify these patients at the point of 911 call. And we have additional resources with our secondary triage colleagues having the ability to triage heat emergencies remotely using internationally recognized tools. BCEHS handbook has been updated with cooling center information, but is not always accurate as there is no central repository for cooling centers. Therefore, the dates, times, and locations may change depending on what region you're in, and you should contact your local authorities for more up-to-date and the most up-to-date information. A reminder that there are several patient populations that are at extreme risks in heat emergencies. We know the elderly is well understood as being at risk, but what is less understood is that those who suffer from schizophrenia or histories of schizophrenia are also at risk. These individuals are very vulnerable, and you should be aware of these risks and consider the role that heat may play in any clinical presentation. Preference should be given to convey these individuals to a safe location, such as a cooling center if clinically appropriate, or a hospital if there's any signs of instability. Consider the implementation of aggressive cooling where required. Regarding practice reminders, it was identified previously, and following several patient safety events related to delayed access to resuscitation equipment, we've amended the clinical practice guidelines, section A1, clinical approaches, to include minimum equipment standards for all clinical operations staff that are attending 911 events. This is to ensure a clear understanding of the expectations when responding to these calls. Related to verbal advanced directives, as a reminder, paramedics on scene may accept verbal advanced directives in the absence of available signed advanced directives. There are several situations, and this could vary. An example would be if someone is in the process of signing an advanced directive but is not yet completed at the time of their death. These are definitely morally and ethically complex calls. They are very rare, however, and you are required to consult clinical when you're making these decisions. So if there is no DNR available and a family member, caregiver, or healthcare delegate is advising that the patient does not wish to be resuscitated, contact clinical to support you in these difficult situations, and those calls will be escalated to EPOS where appropriate. There are some notes and some CPG links in the notes to further support you on this. Regarding substance use referral and patient documentation, one of the common barriers that we're experiencing is that folks are not being enrolled into the pathway if they do not have access to a phone or do not have a phone number. Just a reminder that you can still enroll these patients even if they don't have a phone number. Our health authority outreach teams have suggested we obtain the patient's PHN, their date of birth, full name, and this will help with this will help them connect with these persons. Also ensure that you complete the consent section of the EPCR referral form whenever these A-star pathways are utilized. Our health authority partners extend their gratitude to all EMRs and paramedics for taking the time to refer patients using these pathways. This continues to make a difference in patient care and outcome. Recent changes to the non-invasive blood pressure and scope of practice has led to some confusions of whether EMRs are able to use the Lifepak 15 monitor defibrillator as a tool for monitoring patients, including measuring blood pressure. As a reminder, the Lifepak 15 is out of scope for EMR staff and for all indications and uses. EMA staff may not use the Lifepak 15 as an AED, and they may not use it to measure patients' vital signs. If defibrillation is required, EMR staff must use their Lifepak 1000 AEDs to provide this care to the patients. Continuing with our AED notifications, It's important to note that the Vancouver Fire Department has recently changed the AEDs that they're using for cardiac arrest management. Those paramedics and EMRs responding to calls within Vancouver should be familiar with our process when encountering these new devices. There's additional information in the notes, and that a follow-up video will be posted as well. Ketamine, at 50 milligram per milliliter, 2 milliliter vials, remains on back order. Health Canada is anticipating the return of these vials sometime around mid-July. The March 2023 medication alert remains in effect for the treatment of pain, drug-facilitated intubation, rapid sequence intubation, and excited delirium. It is referenced in the notes as well. The Lower Mainland Pharmacy Services continues to provide compounded ketamine to assist with this shortage. Reminder to remain vigilant when checking the product's expiry dates because it can only be used 28 days after being compounded. Additionally, compounded ketamine in the pediatric patient population under 3 years old should be cautioned as it contains benzoyl alcohol, which is used in the production of the medication. More details can be found in the medication alert. And finally, learning updates. There is a new online safety curriculum posted on the Learning Hub. This is 3 short courses, which includes the BCEHS Professional Driver, the BCEHS Violence Prevention Refresher, and the BCEHS MSI Awareness and Prevention. All clinical staff, including drivers, EMRs, and paramedics, are required to complete this curriculum by December 31st, 2023. This concludes the June update. Thank you for watching or listening, and thank you for continuing to provide excellent care to the patients, whether they're residents or visitors to British Columbia. Appreciate all the work you're doing. Stay safe, and see you next time.